treatment for hyperthyroid, a thyroidectomy. The patient is in semi-Fowler's positioning, going in and coming out of the OR. The patient needs to be what we would call EU, thyroid before we do surgery, because if we don't get the patient's thyroid to kind of behave itself, the risk is that while we're doing surgery, the patient could go into thyroid crisis. So we suppress the thyroid with PTU or methimazole, okay? Now, for this patient who's about to have surgery, literally right here, and in my case, the surgical scar would probably go somewhere in here. They try to put the surgical scar in the crease of the neck, a pre-existing crease in your neck. The problem is that can weaken the muscles, so we need support for the patient's head and their neck, and this is usually done with sandbags, okay? We ask that the patient can even hold their head as they turn post-op. Okay, remember I said that? Okay. This is going to be an airway issue. In fact, one of the things I teach you is that if there's surgery or there's burns or there's trauma to the area above your sternum and below your head, it's always an airway issue. So this surgery definitely applies. So this patient is going to require a trach set at the bedside for airway emergencies, which are a real complication. Now, we have 5 big complications of a thyroidectomy. So make sure you are able to list 5 complications of thyroidectomy. 1 is hemorrhage. This is odd because the patient's going to come out post-op with their head like this in semi-Fowler's, and the bleeding very often may go to the back of the neck. So we need to check the dressing behind the neck and the back of the neck for any kind of bleeding. So you see it says check the back of the neck. This airway and edema issue, I need you to do something with me. So if you're listening to me and you're not in the room where the television is, you got it on their smart TV, but you can hear it, you kind of got to come in the room. So come in the room with me and do me a favor. Take your thumbs and make them touch. Okay, you got it? So make sure your thumbs are touching, and then make sure your middle fingers are touching. If your thumbs and your middle fingers are touching your neck like mine, I want you to just get a tiny bit more snug. Now, don't be over there choking the shit out of yourself, because I can't do CPR from over here in Cleveland, and your little ass would just be sitting there dead. But I do need you to put your thumbs and your middle fingers together and then get a little tighter. I want you to try to swallow with your fingers around your neck just a little tighter. It's really hard to do, isn't it? Like it's almost impossible. That's what I want you to think of when you think of the airway of the thyroidectomy patient. There is edema just because you surgically went in there messing with the poor girl. You went in there messing with stuff surgically. Of course there's swelling and edema. Duh. Okay, so we know that this edema can literally swell around the airway and make it impossible for this patient to breathe. Like there might be expiratory stridor, inspiratory stridor. There may be a bit of a whisper. There may be any number of things to tell you, oh gosh, this patient is not doing well in the airway department because the swelling is so bad. The third third complication is a very, very popular complication. It is very deadly, but it's of course not as deadly as the airway issue. And when it comes to the airway issue, we know that is always going to be in your top 3 priorities. Now, in this case, I told you with the airway how you couldn't swallow, the patient might be drooling and all this other stuff. In this case, for the third complication, the hypocalcemia due to parathyroid injury, this is deadly, but sometimes it doesn't occur for 24, 48, 72 hours. I have had students personally tell me that their mother with a thyroidectomy had this complication and almost died. I also unfortunately had a student tell me that their mother did die, and it was after a thyroidectomy, and it was within the 72 hours. And I dare say this is all about teaching. If you're not teaching your patient what to look for if their calcium goes down, you are missing an opportunity to save their life. So let's look at this a lot closer, right? And so if you are in your endocrine packet, I want to draw your attention to not just this page, which we're doing, but the next page, which actually shows your Chevostix, your Tetany, and your Trousseaus. Here's what's the deal. When the surgeon went in to take the thyroid out, look at the tips of my fingers. On the tips of my fingers is about the size of what we call parathyroid. Now, you know that the thyroid is butterfly shaped. The parathyroids are little tiny, size of my fingertips, little tiny glands on the actual thyroid. They tend to be very adherent. So when you're trying to take the thyroid out, you may take some parathyroid with it. And if you remember your anatomy and physiology, you know that the parathyroid controls calcium and phosphorus balance. And so if you took this parathyroid and you injured it when you were going in after the thyroid, you could easily have a situation where you have hypocalcemia, calcium, right? This hypocalcemia that is due to the parathyroid injury is so serious that I want you to remember quite a few things to teach the patient. The number one thing to teach the patient so that we educate them about something that may happen when they're at home, because very often this is an outpatient, not an outpatient, but a same-day surgery. If anything, you might stay one day because we are worried about your calcium. But for the patient who's actually going to go home, ooh, you got to do your teaching. So let's talk about it. I teach you cheek, CH for cheek, and CH for Chevostix. I tell you to let your patient know that if their mouth or their face twitches at all or spasms, this is a medical emergency. One way the nurse can check for hypocalcemia to elicit that spasm or twitching is to take her finger and tap on the cheek, right? So if you tap on the cheek and the mouth twitches and the face twitches and spasms, oh my God, that is hypocalcemia. Another issue is tetany. Tetany means spasms of the airway, either the larynx, which is your voice box, the pharynx, which is your throat, the oral pharynx area, spasms, even brachial, oh my God, spasms. So all up and down in here is your airway having spasms. So tetany is a who you see first too. And that's all part of the low calcium. Next is trousseaux. The patient with trousseaux, the nurse is going to elicit this by putting the blood pressure cuff on the patient's arm and pump, 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 pump it up and leave it inflated. And if the patient is having a positive trousseaux, their wrist will turn in and their thumb will turn this way, and it will look like this, and it will be a spasm. So it's literally like a spasm where they can't help it, and it's all during the time when the blood pressure cuff is inflated. This is a positive trousseaux. This same patient will have brisk DTRs, and let's just remind ourselves about what brisk DTRs are. Remember that if you're normal, brisk, deep tendon reflexes, you are a 2+. If you are brisk, deep tendon reflexes, you are a 4+. Like you tapped on my knee and I went bam, right? I mean, not really, but you know, I'm like, wow, hyperactive, right? The patient with the low calcium is hyperactive reflexes. The patient with hyperactive reflexes is also going to have clonus. So brisk DTRs, automatically this patient gets checked for clonus. Clonus is where you take your palm, you wrap it around the patient's bottom of their feet, you push back on it, let go, and their bottom of their feet taps you. And there's a certain amount of beats of clonus. Clonus and brisk DTRs are, here you go, pre-seizure activity. So the patient who has a thyroidectomy, the nurse knows to keep calcium gluconate at the bedside to give it IV, because we are so worried about this patient's calcium level, okay? Now, the next complication, because that was just number 3. Number 1, if you remember, was hemorrhage. Number 2 was the airway. The patient was drooling and there was edema around the airway. The patient had stridor, maybe even loud snoring. Hypocalcemia, because you injured the parathyroid. That was number 3. Our 4th, notice I'm giving you numbers. That means write the shit down. Our 4th complication of a thyroidectomy is a thyroid storm or crisis. We covered this in the video about hyperthyroid. It basically is hyperthyroid on crack or accentuated to the nth degree. This patient has all vital signs really high, usually an altered mental status. They are sicker than sick. They're at risk as well for seizures. They are at risk for an MI or even a congestive heart failure. Their heart is in the 200s or 150s, palpitations, AFib, you know, really, really bad. That is your crisis or storm. And it can be triggered simply from surgery. And in this event, what we find for this patient when there is a trigger of a thyroid storm, because it is deadly, is this is easily treated by putting the patient on constant cardiac monitoring or tele device. They may even need to be ventilated. EKG should be done because we know AFib and all sorts of different arrhythmias can result. The stimuli needs to be low, the cool environment, and we treat this patient with beta blockers, which is your propranolol, and then antipyretics because they have a really high fever, steroids, IV fluids, oxygen, and of course, antithyroid medicine, PTU. Now, I want to say something about this complication. We don't see it very often. In fact, it's really rare to see a thyroid storm or crisis as a result of a thyroidectomy because we prevent this by what we call cooling off the thyroid before surgery. We give the patient antithyroid medications like propylthiouracil or PTU, methimazole also. So these are 2 different antithyroid medications, PTU, propylthiouracil, for prevention of a crisis. It's absolutely okay in pregnancy. P for PTU, P for pregnancy. You do need to monitor the liver. or we give the patient what I had, which was methimazole. And methimazole is prevention pre-op as well. It is, however, a teratogen, so we got to do a pregnancy test, right, before we go giving that to anybody. Now, so that's a fourth complication. The fifth and final complication of a thyroidectomy is laryngeal nerve damage. Now, I was scheduled for a thyroidectomy, I think it was like September 16th of 2016. And 4 or 5 days before, I freaked out and said, I don't want to do it. I'm scared because of this complication. This complication is laryngeal nerve damage. So what's the larynx? It's the voice box. I teach for a living. I speak on YouTube for a living. I talk all day long. What the fuck am I going to do with no voice? Hello, that's ugly. So again, laryngeal nerve damage, the patient will have hoarseness, possible loss of their voice. It's really ugly. You don't want it, especially if you're an educator. Hello. So you have to look at the risk, right? You have to say, well, does the benefit outweigh the risk? And since there was another treatment option, which we're going to go into in a minute, I chose not to do a thyroidectomy, and instead I chose radioactive iodine 131, RAI, radioactive iodine. Okay, y'all got me? Let me say that again. Radioactive iodine. So you know what I'm about to say. If this is radioactive and it can treat hyperthyroid, goiters, cancer, you know, treatment for cancer or hyperthyroid. If I'm saying words like radioactive, you know the contraindications is pregnancy or breastfeeding. Common sense. This was a fairly decent sized capsule that I had to swallow, and the dose was determined by an uptake scan that I had earlier. And so I went to radiology, nuclear medicine. I got this capsule and I swallowed it. As you know, with any radiation, it acts locally. And since I swallowed it, it started working all in through my body. So its side effects can be the throat, but it gets into the bloodstream and then it gets into the thyroid. And so this capsule is going to have as its primary purpose to kill my thyroid over time. It may take weeks, 2 to 3 months. During that time of trying to kill your thyroid, you're slowly and surely becoming hypothyroid. And in 30% of cases, you're going to do what I did, which was actually gain quite a bit of weight, 20, 30 pounds, of which I recently lost this year with weight loss shots. Okay, so I'm back down to where I was before that thyroid pill, whatever. Okay, so you will gain weight, and a lot of it, because if I turn you from a hyperthyroid into a hypothyroid, guess what hypothyroid is? Weight gain. Okay, now because the complication, or let's just say the outcome of a thyroidectomy or radioactive iodine is hypothyroid, both of these patients may need lifelong thyroid replacement medication. This is called levothyroxine. Now, if you have to have, and I chose to have this, it was my autonomous decision not to get a thyroidectomy, but instead to go ahead and do the radioactive iodine. If you have radioactive iodine, you're going to have lots of precautions for the first 5 to 7 days after swallowing that capsule. What are some things you're going to have to know? For 5 to 7 days, you should avoid close contact with children, especially those children under 6. They are rapidly growing. And this would not be a good thing for them to be exposed to your radioactive presence. We say stay at least 6 feet away from children. So no hugs, no kisses or anything like that, because this radioactive material is in saliva, it's in your sweat, it's in your tear ducts, your tears, it's in your urine, it's in your feces, it's in vaginal secretions, it's in semen, it's everywhere. So stay away from pets, children, and pregnant women. Common sense, right? We want to push fluids. Like, we like to drink a cup or 2 every 1 to 2 hours. So push fluids, just keep pushing fluids, getting this radioactive material out of your body. So push fluids to flush the radioactive material out. You need to use a separate bathroom. In America, we are blessed. We generally will have another bathroom for usage. Use a separate bathroom. Do not share that bathroom if you can. When you do have to share a bathroom, you need to flush with the toilet seat down 3 times. Men need to sit down to urinate. So you're sitting down, men, to pee. No one should be cooking for the family that has taken radioactive iodine. You're not sharing utensils. You're not drinking out of a water bottle and sharing that, because your saliva's radioactive as well. No sex, no kissing. And for men, they cannot get someone pregnant for 6 months. And for women, they can't get pregnant for a year. And here's the deal. The local side effect, because radiation is local, it acts on the tissue it touches. The localized side effect is a sore throat, swelling, sometimes hoarseness of the voice, but definitely not loss of your voice, okay? So that is your radioactive iodine. Now don't forget, hyperthyroid video and a whole nother separate hypothyroid video is in the endocrine playlist. We did do that for you. If you're like me and you're sad today following the election, it's okay. We're human, we're American, we're accepting it. It's gonna be okay. But one thing I'm excited about is I can't wait to see you guys. We have a boot camp coming up this month, and you know how fun those are. We give away a whole free bunch of resources and materials for the person who actually is in the class and wins one of our challenges. We love on you. We keep in touch with you. We give you your consultation right here in person. We make sure that you understand all 8 of your pink packets. We go through the NGN NCLEX test plan in thoroughness. We do case studies right here in class in Cleveland, Ohio. 3 days are packed. We do pharmacology where no way in hell will you miss a medication on this test. We show you all the different places that you have to focus in those 8 packets. And if you're interested, because we only have a couple spots left, you want to text me at 216-410-0936. This month's dates for the boot camp is 11/22, 11/23, and 11/24. And yes, we do have discount hotel rates up here in Cleveland, literally 5 seconds away from class. So let me know. Hopefully we can help you. And to those of you who are feeling like me today, we will be fine. We are strong. We are fire. We can do this. We will get through this. Help me out, God. Deuces.